drug. What is a drug?
Oh, Miss Bonilla, I'm sorry.
Yes.
Could you go back to that one slide just for a second?
This one?
Yep. And okay.
You take a picture?
So drugs are any chemical substances that produce a biologic response in your body, right? It alters something inside your body. That's why it's a drug. So it can be used as a medicine to aid in the diagnosis, treatment, or prevention of disease. Okay?
Also for diagnosis?
Yes. So what's one drug or medication that we use to diagnose patients? Contrast, Omnipaque, stuff like that. That's considered a drug. For treatment and prevention, we talked about some medications earlier, like Benadryl, epinephrine. Those are used for treatment or preventing. So pharmacology, make sure you know the definition of that. That is a science concerned with the origin, nature, effects, and uses of drugs. So basically, how is a drug made, what effects it causes on the patient, what reactions it may cause, side effects, what is it used for, how can it be given to the patient, all of that deals with pharmacology.
Ms. Bonilla?
Yes.
So by that definition, is oxygen considered a drug?
You tell me.
You learned this,
Oh,
We
you
learned
said oxygen was a drug.
Yes, because it has to be ordered by a doctor, remember?
Mm-hmm.
Yes, so it is a drug.
What about coffee?
Coffee? No,
Why not?
because it's not considered a drug by the
FDA.
FDA. Thank you, Shamika.
and the doctor doesn't order.
Tell
Is that any chemical substance?
So drug
We order caffeine.
nomenclature
If the doctor doesn't
is a classified system of names.
They can order caffeine.
It's basically a system that classifies the drugs by their name, the action that it does inside the tissues, and whether it's prescription or non-prescription. Okay?
Or it will always mention whether it's a prescriptive drug or.
Yes, so drugs are classified into different categories, correct?
I see.
So that it's classified by their name, what action it does once it's given to a patient, and whether it can be acquired with a prescription or non-prescription.
So basically 3 ways of classifying a drug here, that's what you're trying to say now?
Yes. So the chemical name for a drug is probably something very complicated, and you won't really know it by that name, right? So the generic name is the name given to a drug when it becomes commercially available. Can y'all give me some examples?
Benadryl, like you said right now.
Okay. Advil. Tylenol is
That
a
is-
generic name for what?
For anti.
Acetaminophen, yes. So, generic name would be acetaminophen, and then brand name would be Tylenol. And then, generic name, if it's ibuprofen, the brand name would be Advil or Motrin. Okay? So PDR, also known as Physician's Desk Reference, is talking about a summary of all the drugs listed according to its class, the description of the drugs, common brand names for each drugs, the maximum dosage that you have to give for each drug, the reactions that each drug may cause. So anything you need to find out about a specific drug, you can find it on this Physician's Desk Reference. So like we mentioned earlier, drugs can either be prescription or non-prescription. Prescription drugs, what's the difference?
It's prescribed by doctor.
It has to be prescribed by a doctor for you to legally obtain it, or a nurse practitioner. If it is a prescription drug, it's usually dispensed by a pharmacist. Non-prescription drugs, we call them over-the-counter or OTC. And then Dietary supplements, vitamins, herbal remedies, they are not controlled by the FDA, therefore we don't call them drugs.
So non-prescription drugs are curated by the FDA?
Yes.
Okay.
Anything that is considered a drug is under FDA. So just know that prescription, you would need a legal authorization by a doctor or a nurse practitioner, and then it has to be dispensed by a pharmacist. You know, when you go to the doctor and they prescribe your medicine, you have to get it picked up at the pharmacy,
CVS.
right? CVS, Walgreens, okay, plug.
Like I'm not gonna play CVS.
So, drugs, they come in various forms of dosage, tablets, capsule, inhalant, suppository, solution, suspension, and transdermal patch.
So
We've all taken tablets before, correct? Yes.
basically each tablet is a dose, right? You
Yeah,
take one
it is
tablet,
a form
what do I
of
see?
dose, yes.
Never thought it fit that way.
So we've all taken tablets, you know, when we have headaches or whatever, Tylenol. Capsule is a drug that is powdered or liquid, and it comes in that gelatin casing, like the liquid Aleve or Advil, my favorite. Inhalants are medication that you inhale. For example, asthmatic patients that have the inhaler to help with their breathing. I'm not exactly sure the name of what they're inhaling, but that is a type of medication.
Albuterol?
Oh, okay.
Okay.
Jay, what's a DAX? What
Commercials
about
coming in.
suppository?
Put it through your anus.
Ad-free, baby.
Man, the
Those
commercials.
are
ad-free, baby.
Inserted through your rectum or vagina?
Also to the vagina.
Yes.
Oh, I never heard of it.
Suppositories.
I thought they were only through the rectum.
So like for patients that may have trouble pooping, they will get a suppository to help
Suppository.
relieve their bowels.
Breathe in.
Also, if you're vomiting and stuff, you can't keep substance orally, then also you give suppositories.
Yes. What about solutions? Like cough syrup, that's drink.
That lane.
No, you don't.
Oh.
You really don't. You really
Never
don't.
mind.
You, that one was rough.
What do you mean by parenterally?
Parenterally means any way to get into the body that's not through the GI tract.
Like a patch, like a cigarette. You know how people
Yeah.
that come
Nicotine
and
patch?
It's like a
Yes.
patch.
Parenterally could be IV, intradermal. So anything that's not going through your GI tract is parenterally. So, what's an example of a solution that we use in imaging?
Contrast.
Contrast. On the page, is it page? Suspension, you can take it orally, medication that, you know, you drink. And then transdermal patch is something that's applied to your skin, and the drug is absorbed through the skin into your bloodstream.
So
Yes.
suspension, is that like a category? Because tablet would be under suspension too, right?
No.
Tablet, because taken orally.
Suspension is usually in a liquid form.
Okay. Like cough syrup or cough syrup.
Yeah.
See, that would have been a better way to say what you said. You said cough syrup?
Oh yeah.
So the difference between solution and suspension is because solution you put it not in the GI tract.
There was a specific definition for suspension. I forgot to include it on the PowerPoint, but it's in your textbook. If Cody would be so kind to find me the definition.
Okay.
Solution is in liquid form. I think suspension was something else. We're waiting on Cody.
That you having a good time.
It says A suspension is a dose from in which one or more drugs in small particles are suspended in a liquid carrier. Most suspensions are administered orally and should be taken thoroughly just before administration. They should never be administered intravenously. I don't know if that made any sense or not.
To me, suspension is when you take like a pill and it releases a little bit at a time. That's why you can't give it IV, because then you would take the full dose at one time versus over a set of amount of hours.
Oh, it's an
So
extended
like the
release?
solution is just
It's a long
It,
lasting.
so it's an extended release sort of thing?
Yeah, like extended release.
So it's like go at
Yeah.
periods of time.
Right.
Is that
Like
same
it'll
with
say
one
it'll last
medication?
for like
Long
10
lasting.
hours.
Oh, okay.
Oh, okay. I will look that up and then let y'all know next class. Alright, so we have several classification of drugs. There's drugs that do different things, correct? So these are some of the classifications. Make sure you understand these. Analgesics, we have our non-opioids and our opioid drugs. With that, what do you think those two terms mean? Non-opioid and opioid.
Probably something to do with pain, with the painkillers.
So analgesics are drugs that relieve pain without causing loss of consciousness. Okay, and then opioids are drugs that are used for pain relief, and you need a prescription for those. And then these narcotic, yes, and these are more commonly abused, the narcotic drugs.
Or like Pethidine and
Sorry?
Vicodin.
Pethidine and those are painkillers, but they use it as drugs also. That's what
Not
they
heard
use.
that term before.
Like Percocets and,
Vicodin.
Vicodin.
Yeah,
Yeah,
she,
you
that's
gotta-
what she
you gotta
said.
get
Oh.
straight in, you
Yeah.
gotta get straight
Yeah,
in.
It's,
Percocets,
you know, the
Vicodin,
Mike and
Tylenol
Vikes.
3s with
The Mike and
acetylcholine.
Vikes.
That good stuff.
Y'all keep fumbling around this little white line.
That's what I'm saying, you have to get like a little bit street to understand some stuff though.
Yeah. So, if you've been at Bentab, you may have noticed some patients that keep asking for pain meds because they're like, nurse, I'm still hurting, but they've already gotten like the maximum dose. That's because they are
They're
what's
addicted.
called physical tolerance.
Yeah.
They're what?
It's too high.
Crackheads.
Their tolerance
Addiction
level
of
is too
the-
high, so
Yes.
they need more.
So their body has grown tolerant of that drug. So whatever you administer, it's not enough for their body to do that.
I wonder if that, I wonder if that happens because like, you're over medicated. You understand what I'm saying?
Yeah.
Like, when I was in the hospital, they kept asking me, do you want more morphine? I'm like, no, I don't need it. So even though it's my time to have it, right? If I don't need it, why are you trying to give it to me?
They're trying to put you out.
Yeah, so you want
Because,
God, they kept trying to give me
because
the
it stays in your
morphine.
blood, so that's why you're getting within certain time it will run out of your blood, then it will be pain.
What?
So they try to maintain a blood level with medication because that's why you have to have it out. Alright, to maintain a level.
Well,
Then
that's mainly because the doctor may have ordered that medication for
Yeah,
specific
so many
intervals.
hours, yeah.
Yeah, but if the patient does
Doesn't
not
need it.
feel pain, then I don't think you should
Give it to me, right?
medicate them.
Ma'am,
Alright,
I was not really concentrating on it. What does non-opioids mean? You said what does it mean?
non-narcotics. Basically, those drugs are not as abused as the narcotic drugs. These are like stronger drugs that could be abused by patients because they've developed that tolerance by getting it so often.
So non-opioids is something that you won't develop a tolerance for.
Correct. Non-narcotic, yes.
Are they non-addictive?
And then anesthetics, it's in the name,
Numbing
anesthesia, right? Numbing meds. We have general and local. Do you know the difference between the two? Local anesthetics are usually applied on your skin or given as an injection specifically to that area. For example, if you're getting your teeth pulled, you'll get a local anesthetic to that area. And then general will just completely knock you out. It's usually only used for major surgeries. I know general when they took on
When I had patients, they were like,
Ooh, all four at the same time? Did it hurt afterwards? No.
when I had patients, they'd be like, give me that Michael Jackson drug. And I'm like,
Oh,
Oh,
that killed them. I don't
no.
know. I don't know how I feel about that.
But propofol?
Yeah.
I've had propofol. Yep. during
Michael
routine-
Jackson needed it though, like
exam.
to go to sleep. He was addicted.
Alright,
Yeah, he
focus,
was
focus.
addicted.
Yeah, but they're like, give me that Michael Jackson drug. I'm like, you sure about that?
Antiarrhythmics. What does arrhythmia mean?
Rhythm of the heart.
Irregular rhythm of the heart. So, antiarrhythmics would be medication to treat that irregular cardiac rhythm.
Like Tikacin.
Like what?
Tikacin.
Sure. Haven't heard of that.
She said sure.
Antibiotics, super easy, right? You would give that to prevent infection or to stop that infection.
Coagulants.
Coagulants. They stop clotting of the blood, so they're basically blood thinners. Prevents clotting of your blood. So whenever we have patients that come in, for our CTs, you always ask them, are you on any blood thinners? Because when we do the IV, you don't want them to bleed out. So we know to keep that firm pressure for a little bit longer. And then antihistamines. Give me an example of an antihistamine.
Benadryl.
Benadryl. Treats allergies. Alright, I'll quickly go over what these terms mean. Bronchodilator, it's in the name itself. What do you think it does?
Dilating of the
Dilates your
bronchi.
bronchi, so it helps relax your bronchial muscles and then dilate your bronchi. Example would be patients that have asthma or COPD. You would give them bronchodilators. I can't say that word.
Now, what is lumina? What is lumina mean? Drug that cause expansion of the lumina of the air. That's the definition of bronchodilator in our book.
Yeah, see?
Drugs that cause expansion of the lumina of the air, passage of the lungs.
That means the bronchi. So coagulants are drugs that can control hemorrhage. What does hemorrhage mean? Bleeding. And remember, they prevent clotting. And then corticosteroids, they reduce symptoms of inflammation. So I don't know if you guys have seen patients that come into like the floor department to get the steroid injections. They don't have those anymore?
For like knee, like
Like a
knees,
cortisone
knee
shot,
and heel.
shoulder, wrist.
Yeah.
They get the steroid shot to reduce inflammation for patients that may have arthritis and symptoms of that. Stimulants are drugs that stimulate brain activity. So it increases the activity of the brain. For example, Adderall in ADHD patients, that drug helps them to stay focused by stimulating the brain activity. Vasoconstrictors, what do you think that
They
does?
constrict your veins.
They constrict your vessels. So when your vessels are constricted, what happens to your blood pressure?
Goes up.
Goes up. And then vasodilators, causing the blood vessels to dilate. It's used to treat hypertension by dilating that vessel.
Why would you want to constrict your vessel?
If you have low blood pressure.
Yeah, so if you have low blood pressure, you would want to constrict that vessel to kind of increase it. Another definition, pharmacokinetics. Do you guys remember the definition for pharmacology?
Study of like drugs.
The origin of the drug, the reactions of the drug, how it's made, and then pharmacokinetics is the study of how a drug is absorbed into the body. So pharmacology deals with how the drug is made, the reactions. Pharmacokinetics is the study of how that drug affects the person or the tissues. Circulates within the body and changed by the body and leaves the body. So basically what happens once that drug is in the patient. Drug absorption, wow, I can't talk today. Drug movement from the site of administration into the blood, basically how that drug is absorbed. And then distribution, drug movement from the blood to the various tissues and organs of the body. Drug metabolism.
Is lidocaine immediately like absorbed by the body? Is an
Depends
iron
on how it's administered.
intravenously?
Intravenously,
like
it will be immediate. Drug metabolism, how your body metabolizes that drug. And liver is the main organ involved in drug metabolism. Make sure you remember that.
What is the chemical alteration of various substances? Metabolism alters the
Basically, how your body changes the chemicals of the drug. So basically, how your body accepts that drug or uses it.
absorption.
And then excretion, easy drug movement out of the body, and what organ? Kidneys. That's why for CT we check the patient's kidney functions. Because if their kidney function is low, they won't give them contrast. Okay, I will stop right here for today.
So really?
Know the definitions for
Literally as soon as the lights
pharmacology and
went out.
pharmacokinetics.
That's just smooth.
And then know what, like metabolism, absorption, excretion, what that means. And then which organ does what. Like liver metabolizes, kidneys excrete. The definitions?
You good? Okay.
So just know what
You got
it
it?
is.
Yeah, just know what purpose it is, it does. I wanna ask you like which medication will do what.
Ma'am, did you say for CT kidney function is seen for what? What's the absorption of drugs?
Because kidneys excrete the drugs out of your body, right? So what is a drug that we use in CT? Contrast.
It's different. Only findings.
Yes, so if the patient's kidney function is low, the kidneys won't be able to excrete it properly.
So you're saying for CT kidney function is seen so that if it can be seen like the medication can be treated or not.
Correct, because you want that stuff out of your system. So if the kidneys don't function properly, then it will be toxic.
And Angelica, propofol is used when they're doing when they go in. Yes. Yeah, now it does, but it's still loopy. So when they cut it off, you wait right on.
No.